virtual meetings allow us to record the sessions. And so I can go back and watch Sue's and Susan's at a later time. My name is Melissa Adolfson. I'm with Wilder Research. And I've been trying to support collaborative communities as they move from phase 3 to phase 4 as part of the More Resilient Minnesota initiative. So I'm going to walk through kind of the boring slides, and then I'm going to hand it over to the Itasca County A team to talk about the work that they've been doing. So before we get started, I just wanted to kind of have a sense of who all is on the call and where you're at in the More Resilient Minnesota initiative, if you're even on that journey. So what I'd love for you to do is to go to the Zoom toolbar, and there should be an option if you click on the 3 dots to annotate. And then once you select annotate, you can select the option to stamp. And you'll see different icons that you can use, a heart, an X, a check mark, and just let us know where you're at and where your collaborative community is at. Are you already in phase 4 like Itasca County? Are you in phase 3? You've collected some information and you're getting excited about phase 4. Maybe you don't even know what these phases mean. That's fine too. But just kind of, again, if you can find that annotate option. Is that not an option with this particular? Okay, shoot, I'm not seeing, I usually see it.
I don't know if it's enabled for this one. Sorry, Melissa.
Okay, that's okay. Well, then maybe just in the chat box.
I see it.
Oh, do you? Okay.
Okay. So are you talking about when you go to reactions and then like you say at the end, it's 3 little dots?
I don't know if we all have that.
Yeah,
okay.
We'll just skip that. So if you could just in the chat box say which phase you're in, that would be lovely. Great. So we've got a lot of phase 3s, a couple of phase 4s, and just starting phase 1. So looks like all over the map. I hope there's something in this presentation for everyone. We've got some phase 2s. Lori, it looks like you're phase 2 going on phase 3, and some others who are kind of on that border. So welcome everyone. Thank you for being here today. As Emily noted, after I get through my presentation, I'm going to be handing it over to Angie, Tanis, and Kim to kind of tell the story that they have from So one thing that we heard at community resilience conversations across Minnesota is that people were energized and excited by all of the learning from the trainings, the presentations, films on ACEs, but they were really ready to start moving from learning and gathering data to action and putting that data to use. So phase 3 of the More Resilient Minnesota initiative is really gathering input from the community. And for those who are just in the social emotional learning session, there was that video clip that was really powerful where it was noted that if you want to know what youth and families and community members need, you need to ask them. And that's really what phase 3 is all about, asking the community what they need. And there are a couple of ways that communities have been doing that through More Resilient Minnesota. One is through community resilience conversations, where you're gathering individuals to have small and large group discussions. And another approach is through sitting down one-on-one with community members to ask them directly what they need. And then using that information and input that you gather from the community as you move into phase 4 and figure out, okay, now what are we going to do about all this information? What strategies and activities are we going to implement to build community collaboration, but also enhance resilience measures and reduce ACEs? And so you might wonder why all the branding. You'll see there's community resilience conversations, all starting with CAPS, community resilience plans and initiatives. And part of that is that we've been really working closely to put together some kind of structure and guidance documents that communities can lean to while still having some flexibility and customization. And so the reason we're using some of these, what kind of jargony terms, is that there are resources and materials and handouts that align with each of these. So if you want to know, what's the difference between a plan and an initiative, FamilyWise's website has great information with all of those details. And so we're going to be walking through some of these pieces. And we also hope that by providing some semblance of structure, there is a little bit of fidelity to the process, so that we can learn what's working from community to community and across the state. And then total sidebar, but I realized that I've been working way too much because our new dachshund pup, who's actually more of a teenager, has been throwing his tennis ball for himself and fetching it.
Oh, wow.
When I plugged this photo in because I was looking over thinking I was being a bad dog mom. The other thing that I wanted to share for those of you who are in phase 3 or in phase 4 is that DHS did issue an opportunity to apply for micro grants this past January. And 4 communities that were in phase 4 were selected for those micro grants. Itasca County is one of them, so they'll be sharing their story later this morning. And so the microgrants really allow communities to identify one component of their community resilience plan that they wanted to implement with these funds. And because they're small dollar amounts and a short time frame, communities were just asked to come up with some very feasible short-term outcomes that could be achieved as a result of that microgrant. And I wanted to put the slide up front for those of you who are in phase 3, because we are anticipating that there will be another round of microgrants coming out, perhaps later this summer. So hopefully there will be some tidbits here that can help you get ready to apply for that. Just as kind of a quick recap of phase 3, for those of you, and a little bit more detail about how we're collecting data. With those community resilience conversations, it's really been about bringing people together for shared learning and relationship building and to find out what the community needs are. As I noted, it provides a great opportunity for some of those small and large group discussions when it's safe to gather together. Another thing that's helpful about those group dynamics is that an insight or idea that's shared by one community member might spark other ideas from other participants. And another thing that's helpful about bringing people together is that it provides a kind of more streamlined opportunity for sharing more information about the More Resilient Minnesota initiative, ACEs and resilience. On the other hand, those 100 cups of coffees or one-on-one community interviews really allow you to have a much richer, more in-depth conversation. And it can help build rapport and build relationships between the person who's doing the interview and the interviewee. And I think one thing that's really helpful about it too is that you can reach people who wouldn't necessarily feel comfortable attending a community resilience conversation, or who might have a lot of barriers to participating in a community event, whether that's transportation or childcare. And if you haven't seen it, there's a lovely article that was out about Beltrami County's 100 cups of coffee. And it really hit on that second bullet, hearing the interviewers talk about how impactful it was to sit down and have those community conversations. And we found, in the Beltrami County's example, they had that community resilience conversation and looked around the room and noticed that there were a lot of people from their communities missing. So I would strongly recommend using both approaches. For that micro grant out of DHS, you can use one or both of these, but you are required to reach at least 50 community members through one or both of these processes. So then I'm really here to plug the data and data-informed decision-making. In addition to the community resilience conversations and 100 cups of coffee that are required for the microgrant, there's also lots of opportunities for gathering stories and input from community members through focus groups and listening sessions. So I strongly encourage multiple approaches. And I think that can be, focus groups are kind of a a nice mix between a large group event and a one-on-one. So you can bring together some like-minded people to have like a smaller conversation. And then also balancing that qualitative data, the stories, with quantitative data. And so working with DHS and FamilyWise, I know that communities who are especially in phase 3 and 4 have been getting fact sheets specific to their county or school district. And those fact sheets have a lot of rich information about ACEs among youth, as well as a number of resilience measures. And here I'd really like to put in a plug for the 2022 Minnesota Student Survey. If you happen to be in a community where your school district is on the fence about whether or not they want to participate, they have concerns about time, they have concerns about the sensitivity of some of the questions, especially around ACEs, I think this is where we really look to you all to be champions and to promote the importance of participating in the survey so that we have data that we can use to guide our action planning. But over and above the Minnesota Student Survey data, also taking a look at any local data you have on child abuse and neglect, maybe some American Community Survey data, looking at poverty, housing, and then any administrative data you might have from area organizations that can all kind of help tell the big story and paint a full picture of community needs. One thing that I think is really important to acknowledge is that while we have this kind of package of technical assistance and guidance documents to help communities as they move into phase 4, every community is different. Each community has very unique needs, and those community resilience action plans really need to be focused on a localized effort. And one thing that was exciting, a couple of months ago, we had all of the phase 4 grantees that got a micro grant get together on a learning call and share, some of the commonalities, but also some of the different issues that are being addressed, whether they're in an urban area, a rural area adjacent to a tribal nation. Each community looks different. And one thing that we heard from some of the phase 4 coordinators is that the process isn't always linear. It's iterative, it's cyclical. We also acknowledge that for many of you, putting together a community resilience plan and implementing it is not necessarily your primary role. In addition to being a member of your collaborative, you may be a mental health provider, a teacher, with busy days. And so figuring out how we can make this kind of everybody's role. And then also just acknowledging, again, that, one size doesn't fit all, and what works for one community won't necessarily work. So the one thing that I would inspire you to do is just as you're sitting down and looking at all of your phase 3 data, be really curious. I think sometimes we can get stuck in thinking that we know everything that we know, and just being open to hearing perspectives that you weren't aware of and weren't familiar with. So, what are the data telling you? Are there some common themes that are emerging? Or are there are some things that you're hearing from community members that seem to contradict what some of the professionals that have been around the table have been perceiving or hearing? Who do the data represent? Again, if you have data from a community resilience conversation, does that represent everyone in your community, or are there folks who aren't coming to the table? And then also, as you're putting together these plans, thinking about which data are most actionable. Not that you don't want to work on the things that are going to be more of a marathon to address, but also making sure that you identify some things that will be kind of maybe an easy win and success to keep the energy and momentum going. One note about the action planning process is that there are a couple of approaches that could be taken. And then there's the third, which is just putting together an action plan in isolation in a bubble, and please don't do that. But so one approach is making sure that your action plans are community informed. So really utilizing what you learned in phase 3 from the one-on-one conversations and the community conversations. Putting together a community-informed action plan still often involves some of the usual suspects being at the table to actually craft that plan. But one of the benefits of that is that you can more quickly come to identifying clearly articulated strategies and activities and how you're going to measure those. Another approach is ensuring that your action planning is 100% community driven. And I think that this is the gold standard, but it takes time and especially takes that kind of cyclical and iterative process. So this approach would involve bringing in those emerging leaders that you identified from the 100 Cups of Coffee or the community conversations to help drive the planning. And that's going to require more time for relationship building and trust building. And that's an approach that Beltrami County was taking with their microgrant, is kind of putting together a plan to develop a plan. So they were inviting individuals who participated in the 100 Cups to come together in virtual meeting spaces to meet with community leaders and share their ideas for what should be put into the plan. The community resilience plans include 2 goals, and there's a template that is shared on the website for the session, and Emily was going to put a link in the chat box to it. But there's 2 goals. One is really enhancing community capacity and collaboration. So expanding leadership, bringing new people to the table to help make decisions, finding ways to come together, whether that's through a community resilience conversation, to watch a screening of Paper Tigers, just to get to know each other, shared learning through our presentations and trainings, and then making sure that we're using data to find out whether or not we're seeing results from our efforts. And then goal 2 of your community resilience plans are focused more on implementing specific activities and strategies that will help prevent adverse childhood experiences, but also will help enhance resilience measures. Just a little bit more on that goal 1 and what each of these categories or buckets looks like. So for leadership expansion, making sure that your community is training a more diverse array of community members with ACE interface. And for some communities, that's meant getting more sexters to the table. For other communities, that's meant making sure that individuals who are trained on ACE interface represent all aspects of the community, whether that's race, ethnicity, sexual orientation, depending on how people are defining culture and community. Again, finding ways to invite those participants from one-on-one interviews to the planning table to be involved. And then really identifying concrete leadership roles for a variety of leaders. And this is where I think it can be really helpful to have a detailed action plan with little feasible action steps that people can sign up for and take on as a community leader. Finding different ways to come together, again, having those small and large group conversations and taking time to really intentionally build relationships. And I think that those leadership expansion and coming together really go hand in hand because it requires those intentional relationships to ensure that emerging leaders feel safe with the planning. Again, shared learning. In phase 4, a number of community members realized that they thought that they had trained everyone in the community during phase 1 and phase 2 and found that there are still a whole lot of people who haven't been reached. And then again, I'm going to be talking in a little bit about the importance of evaluating what we're doing, celebrating our successes, and then figure out what's not working so well. In terms of goal 2 and enhancing those resilience or protective factors and preventing ACEs, it's really important to ensure that your community resilience plan has some strategies that focus on individual, youth, and adults that look at factors addressing relationships, relationships between youth, their parents and caregivers, extended family members, and other social supports. Also making sure that we're addressing more community level strategies within schools and work sites. Thinking back to the social emotional learning session from just before this session, are there ways that we can reach adults through work sites with social emotional learning, and expanding that beyond the school settings. And then also taking a look at some more societal factors that we might be able to address, looking at our communities, policies and practices and systems, and how they can be improved and more equitable. So I just wanted to share a few examples of what moving from data to action might look like. So in one community, based on their 100 cups of coffee, they found that there were a lot of school staff who were still not familiar with ACEs. So one strategy they identified was, as part of a teacher and school staff in service, making sure that they're getting a presentation on neuroscience, so that they're all familiar and aware. Participants from ACEs presentations and trainings shared in one community that they wished there was more local data in the presentation, because some of the data shared was either state level or from Washington state. So one potential activity to address that would be to make sure you're infusing your presentations with local data and sharing your ACEs fact sheets widely at community events. In one community, through community conversations, actually several communities said they heard from people that there was a lack of awareness about available resources. So some of the Facebook communities who have a microgrant are working to create a resource directory to help raise awareness of what's available. You might see that your Minnesota student survey data show there's a large percentage of students who say they don't have an adult in their life that they can talk to about problems that they're having. One example of an activity that one of the microgrant recipients is doing is launching a lunch buddy program to help pair local adults in the community with second graders to make sure that they do have that one caring adult in their life. And then in one community, interviewees expressed a lot of concern about bias-based bullying, and that community's Minnesota student survey data backed that up. Students were reporting that they were bullied frequently, and that they were bullied because of their gender identity or their race. And so one potential activity to address that data point would be hosting a community event that features a local author's book on bullying. This is kind of a take on what Robbinsdale is doing with the changes for the example. And then this is just an example of a template for that community resilience plan that's in the guidance document. So really breaking it down into those small action steps. In this case, it's an example of bringing social emotional learning curricula to a school. And so breaking that down into little steps. Step one is meeting with district stakeholders and parents. And that came out loud and clear in the social emotional learning session, is that the most important person in a kiddo's life is their parent or caregiver, and making sure they're at the table to help make decisions about what will be implemented in the school. And by breaking down the social emotional curricula strategy into bite-sized steps and activities, you can really help identify where there could be leaders and champions who could take on a role and take on pieces of this work. So now I wanted to talk a bit more about outcomes. How are we going to know that these activities are working? So those shorter term outcomes that we're asking microgrant recipients to identify in their community resilience initiatives are those shorter term changes in knowledge, skills, and attitudes that we'll hopefully see through providing training, having more conversations. Then some of the more intermediate or midterm changes would be actual changes in behavior. And those can take a while once we get beyond, watching a screening of paper tigers or attending an ACE interface presentation. How do we get to actual changes and steps that people are taking as a result of what they learned? And then those longer term changes are going to be more systems level changes, making sure that families and youth are reached equitably with services. And that can take a really long time. In our learnings from Washington State, their family networks were at it for 15 years. And so, really looking for some of those shorter term wins. I think another thing that is hopefully helpful about the resources and documents we've put together to provide some structure is just in that learning from Washington State. We did hear from Laura Porter that at the outset, it was kind of messy. They said, go try stuff, see if it works. And they weren't doing a lot of documentation or tracking of outcomes. And it was great in that it led to a lot of innovation and flexibility. But then in hindsight, when they were reflecting, they wished they would have, had captured more information to find out what was working, to be able to share from community to community. And then really making sure that the outcomes that you put together are specific to what you hope to see, that there's a way you can even measure that. And then that it's something that is attainable. Again, so setting yourself up for success when you put together a plan. Making sure that the data that you have available are relevant to that measure and match it. And then just thinking about when the data collection happens. So if you're relying on a measure from the Minnesota Student Survey, you're only going to be able to get that data every 3 years. And know too that as you're working on a community resilience initiative application for a microgrant, we're here to provide support. Actually, Anne might force that on you, but hopefully Kim can attest that it's not too painful of an experience. So I'm here to help make sure that outcomes are as smart as they can be. So just thinking about how we're going to measure that success, how will you know that you've achieved what you wanted to? Some outputs that we might want to be able to track and count are number of trainings, number of people trained, number of families referred for services, how many people are clicking on your online resource guide. And then for outcomes, thinking about how satisfied were people with the ACEs training they received. For emerging leaders who are coming to the table that you reach through the 100 Cups, are they satisfied with the leadership opportunities that have been presented to them? Trying to do maybe follow-up surveys with people after a training or presentation to find out, did they change their behavior? Did they take one step either in their personal life or work life differently as a result of having sat through that training? Regularly reviewing policies to see, are people changing their policies in their schools or work sites as a result of the shared learning? So this is just an example of what this might look like when you put it all together. And so for the community resilience plans that we provided a template for, these are kind of big overarching plans with strategies that fall under goal 1 and goal 2 and a number of different activities. For the micro grant, we realized that it's, again, with a small amount of money and a short timeline, it's not enough to cover an entire community resilience plan. So for those initiatives, we're really looking for you to find a couple of activities that you're going to do that would be feasible to address with the micro grant. So in this example, your community resilience plan might include offering near science presentations for all school staff. And then really making sure that as a result of doing that, you're increasing knowledge of school staff. The school staff are actually taking steps as a result of it to build better connections with students. And then in the long term, we're hearing from students on the Minnesota Student Survey that they feel like their teachers care about them. As a separate activity that you might pitch for the micro grant to be covered would be using that example of hosting a community event to feature a book on bullying. So the things that you might want to track for that are, maybe using a super short 3-question participant feedback form to say, hey, how did you enjoy the events? What did you get out of it? What did you learn? And then perhaps following up a short time down the road with some more one-on-one interviews, because it's not ever a one and done process to gather community input. And find out if perhaps some of the people who attended that event engaged with local school administration to have conversations with them about changing their bullying policies and putting in curricula to help prevent it. And then over the long term, maybe reviewing those school policies to see if in fact they did change, and tracking your Minnesota Student Survey data through school participates in it to see if you're actually seeing reductions in those reported bullying behaviors. Move a little bit more quickly, but just as another example, in one community that was they identified that activity of the Lunch Buddy program that was part of their overall plan, but not part of their microgrant initiative. And then to track that, we can, talk with those mentors, those buddies, and find out if they feel like they've seen a difference in the youth that they're interacting with, and finding out what they personally get out of being a mentor and a lunch buddy. Over time, maybe chatting with teachers and school staff to see if they're seeing improvements in classroom behavior over time and engagements in education. And then over the long term, seeing if we're seeing an uptick in the percentage of youth who are reporting a positive sense of identity. And in this particular community, for their microgrant, they decided to develop a resource directory and intentionally partnering the Chamber of Commerce to make sure that that's sustainable over the long term. And one thing that they were really interested in is making sure that local Hispanic and Latina families were getting connected with resources and were familiar with them. So they were making sure that the website and resources were translated. And so in order to measure how effective that's been, not only tracking the overall number of visitors to the site, but perhaps doing focus groups with local Hispanic families to see if they've used the site, if as a result, they actually access services. And then checking in with local service providers to see if they're serving more Hispanic and Latino families as a result of that resource guide being developed. And then I have some big picture questions that I would like to discuss if there's time at the end of this, but I want to make time for the Itasca County team. But one of the questions I wanted to chew on is, what does a more resilient Minnesota community actually look like? Some of the microgrant applications that we got in had longer term goals of our community will be more resilient, which is lovely and wonderful, but going back to those SMART objectives and outcomes, what does that look like? How are we going to know that we're there? And I don't think that we're going to have the answers today, but I'd love to have that conversation. But before we get to that, I just wanted to share the link for the phase 3 and phase 4 documents that I kind of sped through. But there's a lot more language on definitions, requirements, and templates for a resilience plan. And before we move to Itasca County, I know I talked really fast. I wanted to see if there were any questions about more of the technical pieces of phase 3 and phase 4. Anything in the
Could
chat?
you please go back a slide? I'd like to write down the PCAMN.
So all of these documents lay out examples, templates, what is required to move from phase 3 to phase 4, what's more flexible and customizable. The 100 Cups of Coffee interview tool similarly has, these are the pieces that are really important to do and just keep fidelity to the tool and the process. And then there are elements that are more customizable for each community. Right. Well, if there's no questions, then I would like to turn it over to Itasca County's A team. And so I'll kind of start with a prompt. And so for each of you, if you would like to introduce yourself and say a little bit more about your role in your ACEs and resilience work, that would be lovely. So starting with Angie, could you say a little bit more about how Itasca County has been adapting your ACEs training to infuse it with more local data and local information, and then also infusing that local emphasis on hope and resilience?
Hi, everybody. Good morning. Angie Erickson, and again, North Homes Children and Family Services. And I guess I don't know exactly what my role would be within our ACEs cohort. I feel but trying to be as active as possible would maybe be the best way that I can think of describing. And our cohort, as kind of part of some of the work that we did in phase, sort of that bridge in phase 3 to phase 4, identified locally sort of what we wanted to look at was sort of two buckets. And of course, Kim and Tanis jump in at any time if there's something else to add in here. So sort of this idea of hope and resiliency and looking at our training specifically, obviously keeping fidelity to the ACE interface curriculum, of course, and what can we do to adapt it so it really meets the needs of the folks that we're either have already brought it to, or the folks that we're still trying to meet and connect that with. And I think, you know, very, very early on and very loudly, the people that we were, you know, bringing the training to are like, what's happening here? And I feel like, I mean, that's kind of area, like, how does this affect me, and how does this affect my family and my neighbors and the people that I care about in my community? And so, you know, kind of currently still working on developing that, but really, you know, utilizing those fact sheets from the county, and how does that really, you know, what do we really see here? How does it look different from the state and from, you know, other information that we have? Because I think that is really telling. And I think it engages our own personal community members in a different kind of way. We're also part of that training bucket. We're looking at adapting just some different resources. So recognizing some folks, you know, we might have a good 2 hours or more, and other people are like, if you can't do this in 30 minutes, like, don't talk to me, right? But we want them to get that information. And so we're working kind of to adapt to have a few different things. How can we give this information to them for those that we can do a longer thing, working on adapting and building some new activities to kind of help facilitate and strengthen that learning.
Angie, I would just add in, I made a note here. I think it's really important when we have this discussion about adapting to your community, especially for our new ACE trainers. One of the things in my role, I'm Kim Geislinger, nice to be here, and thanks for the invite, Melissa. I work for an agency called Ross Resources, and we are contracted with our 4 school districts in Itasca County. I coordinate the truancy prevention program. I'm a recovering probation officer of many years, as I've been told. And truancy and school attendance, educational neglect has just been at the heart of my work for many, many years, because I think it tells so many stories about families and communities and where we need to support kids. So I love the SEL work. Super excited about how we're calling out that adults need this work and training if we're going to model it to kids. And so I think the ACE work just fits beautifully into this. But specific, and I'll turn it back to Angie, the thing that sticks out to me is one of our top ACE scores for kids here in Itasca County is an incarcerated parent. That looks very different than maybe some other counties. And so how do we present in community to that when people think, what? I can't believe that would be such a high ACE score here. And so really recognizing that some of this information is very kind of shocking to community if they've never had involvement in that. And for others, it's normative. This is kind of what they know and what they've dealt with. And so then how do we be able to have all those voices at the table and have some collective wisdom about that that's going to help our community grow and be supportive of each other?
Did you have more to share, Angie, or would you like me to move on?
Or, yeah, not right. The question, sorry, this is me, like, what was the question? Just specific to training, right? I think if the training, yeah, then I think we're good.
And I'll just pop in here using my evaluator hat and say that, you know, as we were talking through that step of the action plan, you know, taking a look at the post-presentation surveys to see, were people satisfied? Did they feel like the information was relevant to them as a resident of Itasca County? And, you know, maybe even adding a question to a post-event survey that you have, asking specifically about that. It's a, you know, really feasible, easy way to get a short-term outcome. So Tanis, I'm going to turn it to you. And if you could maybe say a little bit more about the trauma tool that you've shared with schools and, other steps that you took with your mini grants to support teachers and school staff.
Absolutely. Thanks for having me. I just want to acknowledge that our school has been in hybrid and it's the second last day of school. So if there's like announcements or something weird happening, that's where we're at today. Flexibility is the name of the game this year, that's for sure. See, so every couple minutes it's going to ring for a couple of minutes. But so my name is Tanis Henderson. I'm a school counselor at Deer River High School. I'm also a licensed professional counselor. And I've been involved with the resiliency work in Itasca County since its inception. And I'm an ACE interface presenter and have had a lot of these, a role in the community conversations that we've been having across the county. And so when Kim and I were talking about, some of the data that we received and kind of what direction would be headed next for the micro grants. One area that we talked about was really about the trauma that we know all of our students are experiencing this year on top of all of their other trauma. And so trying to really equip staff to be able to keep resiliency and being trauma informed in their, the front of their mind as we're like ending this year and into next year. We don't know what we're going to see yet as far as outcomes for students. I mean, some students haven't been in school in over a year, and next year they're going to be walking through our doors and we have to be prepared for, wherever they're at and just kind of meet them where they're at. So we really looked at, so we have it's a tool from the ASCD and it's called Creating a Trauma Sensitive Classroom. And so we knew that we wanted to get this in the hands of the people that needed it the most. And so we really thought about both distribution and evaluation, to go along with the tool. For the short term, we thought about we wanted to make sure, obviously we want every teacher to have it, right? But that's not a reality with funding. And so kind of narrowing down with, who are those people that have the most interaction with the students with the highest number of ACEs in our schools? So, our special education staff, school counselors, school social workers, truancy prevention workers, some cultural liaisons at some of the schools. And so we kind of, thinking about the local conditions, each school identified who those people would be at each of the schools. And then we created an evaluation tool that really goes along with almost like I would say a learning guide or like a training, so you're doing the evaluation at the same time you're learning how the guide works and how it's used. So this is nice. It's broken up into 4 big ideas. It's about what is trauma. So if people haven't attended an ACE interface presentation or had any other stuff, it has all of the information just right here on the front page. The presence of trauma, fundamental truths, and what does it mean to be a trauma sensitive learning environment? And then the big ideas are really about that foundational self-awareness, relationship, both with students and staff, your belief in how you conduct yourself as a professional within the school. And then there's the big idea number 4 is about live, laugh, and love, and really about those daily interactions with students. And then there's also a piece on self-care, and there's a self-care challenge because we know that there's a huge risk of burnout with staff in schools who are working with students with high ACE scores. So this guide also has a accompanying book that actually our school did a book study on that has discussion questions, but so there's the guide and there's the book. But I would say I was listening as Melissa, I was like, what are our outputs and our outcomes? So our outputs would be that, that how many people are trained, based on what we had. And our outcomes is, the satisfaction with the training and knowing that if they did the survey, that they've gone through and used the guide. And then they'll have it there on their desk, starting next year. And it can be a trigger point for them to kind of come back to it and keep remembering and growing deeper in their knowledge about creating their trauma sensitive classroom or space, whatever that is. That's what I have if there's questions too.
And then Kim, do you want to talk a little bit more about the HOPE work you're doing aligns with other initiatives in Itasca County?
Sure. Just to follow up, thanks, Tanis. on the tool. The other part of our micro grant is we decided to peel off a little portion of the money and offer mini grants. And I just want to mention it because we were pretty overwhelmed with how the response was and how immediate the response was from teachers. So we developed a letter and just offered grants up to $200, just little mini grants for them to you know, to come up with any kind of activity or tool of some sort that teaching staff, counselors, anybody in the schools in the year of a pandemic could apply for to build hope and resiliency for their students. And we just had some really awesome applications. It was pretty awe-inspiring of what all teachers, which we all know, they dig deep in their own pockets to make their classrooms supportive for kids. But Angie was involved in kind of our summary of that. We kind of made a scoring sheet, you know, put some objectives similar to what Tana said, so we could kind of evaluate why we were while we were doing the actual action. Because we're all super busy, everybody else is working full time, as most of you are, and but anyway, we submitted or returned that money into mini grants, anything from little resiliency buckets that were going home with students for a family activity night, to kids picking and painting a word on a canvas and then having a lesson about that, social emotional learning lesson about that with their families. Just some great things. So that was really, I think, an awesome thing that bubbled to the top for us, that I know as the collaborative coordinator here, that we are definitely going to take some of our ACE Hope, you know, budgeted money to kind of continue in that process, I think, next year in our school districts. I don't know, Angie, if you want to say anything else about that.
Yeah, well, I was just going to add, and I mean, I think you already talked to this, but to really point out, I think the response for people interested in the micro grants was awesome, but also from like my own perspective, like getting to be inspired by what does maybe resiliency look like to like a microcosm within our community. And really being able to talk to why does this matter and how does this really support resiliency, you know, for this particular group of kids or for this particular school. And so just how that was another way, I think, to kind of further engage our community in a really, I mean, going back to those unique needs. Here's a really unique need for this group of 30 kids that we know that this is going to support them in that kind of way and help add that hope and resiliency. And then I think, or sorry, and Kim, or if that's okay if I also jump in, I didn't want to forget to add just the video series that we did, right, Kim? Okay. And so this fall, through some conversations as an ACE cohort and kind of this hope and resiliency, really wanted to look at how do we maybe highlight the things that are going well in our community and the ways that our kids in particular are already continuing to be resilient through living in a pandemic, right? So recognizing that, trying to look at that strength space, that it's not, yes, we know that this is impacting everyone, right, negatively, but how are they thriving and surviving? Because that's what we know our youth do, right? And so worked with some youth throughout our programs and created sort of what we call the Finding Hope series. So looked at happiness, opportunity, positivity, and empathy, and had interviews with those kids and had them really speak to those different pieces that they were really seeing and connecting with.
And so going off that, our hope work, as Melissa alluded to, Itasca County, we've been very blessed with receiving 2 planning and implementation grants through the Department of Human Services, which for some of you may be familiar, that's with the underage drinking prevention grants that partner with the Montana Institute and work off of the science of the positive framework. And so from 2011 to 2016, we had that grant housed in our Deer River School District. And then from 2016 until the 30th of this month, we currently have it housed in our Grand Rapids High School, and they will be transitioning or have transitioned to a drug-free community grant. But if people are familiar with the Science of the Positive framework and the Montana Institute work, Dr. Jeff Linkenbach, that framework infusing the science, spirit, action, and return model, this, secular model, has really been infused in Itasca County. And so when the ACE work came about to the collaboratives, it really just kind of fit already into the work we were doing in trying to promote the good and growing the good in community despite the concerns. There's just this constant balance of hope and concern at the heart of Dr. Linkenbach's work. And so when we talk about ACEs, honoring those concerns, but really trying to figure out the hope that does exist in community and making that top priority. And so we as a collaborative did not involve ourselves in the 100 cups of coffee, because part of our P&I grant requirements are doing community conversations. And although they specifically focus around people's perceptions and misperceptions of underage drinking, as many of you who have done community conversations, that's what gets us into the conversation, but the conversation becomes bigger. And what we find is the perceptions that adults have in the community many times mimic the perceptions and misperceptions that kids have about us as adults and what we think about them, and vice versa. And when you talk about specifics of underage drinking, suicide prevention, incarceration, all of these things, we found that kids and adults are many times on the very same playing field. But we don't often talk about that, oh, I had that same misperception as you did. And so I think all of this work just beautifully ties together. I really like this morning, I was in on the SEL training, and the presenter talked about, her values, finally finding that your values as a person aligning with the work that you do. And I think that is, we have to be vulnerable in this work. And I think that's what the work of ACEs does, the work of trauma does, and how we honor people's stories. So we feel like pulling all of this together has really been important for our work to move forward. I think our biggest thing is being strategic about who comes to the table first and who is going to be at the table to get it back to a bigger audience. So, I work for a private agency that has contracts with the county and the school district. Tanis is a school district employee. Angie works for a very large nonprofit that's involved in youth and family supports. But just the ripple of just the three of us that are here, what we bring back from the table, we know is going to go to a larger audience. So as a collaborative coordinator, I appreciate that kind of strategic planning. I'm not strategic, I'm a woo. So I appreciate these two. But just those are some of the, I think, thoughts I have that, like, this work to me from 2011 when that P&I landed here, it has really started the transformational process in our county. And we have a long way to go. I mean, I pulled out our resiliency plan that Melissa, she's great to work with, so please utilize her services. This will change constantly. Our trauma tool, we're super excited about it, but trying to get it out at the end of a school year with the pandemic right now, with another district that had to go back into hybrid, I don't know what our data is going to look like. And instead of being panicked about it, we're kind of like, well, that's going to tell our story that maybe this wasn't the greatest time to try and get this out because it's such a good tool. We want to honor the value that it's going to have in the fall. And so I just think it's a constant changing process and great learning.
Thank you so much for making that point, Kim. about what our 2022 Minnesota student survey data might show. In working with Deer River's full service community schools, we are trying to establish some objectives and target goals. And, maybe the target goal is that we don't see an increase in students reporting depressive symptoms. And, trying to track outcomes related to truancy during distance learning are just kind of out the window. So I think that that's a really important point to be realistic about what our data might look like these next couple of years.
I want to call to Melissa, just from my work in the schools, it's really important that you did encourage people, if you do have any connections with your superintendents, to talk about not opting out of that survey. These significant grants like the P&I grant, $1 million into a school community for 5 years, some of those grants are not accessible if you don't have that data. And the Minnesota Student Survey is such a great data tool for districts to be able to apply for some of those grants. And a lot of the districts did not know that. We had mentored a district in central Minnesota to apply for that P&I, but they had opted out of the MSS tool in 2016 and did not have the data they needed to make that application. So super important that schools participate.
I think another thing that's great about it, and I swear I'm not getting paid by the Minnesota Student Survey interagency team, but just in the connections that Tanis was talking about, your community has a collaborative. You probably have a SHIP coalition. You might have a substance misuse coalition, a suicide prevention coalition. And that data really helps us see the strong associations between each and how each are influenced by ACEs and how protective factors can help across our initiatives. So I think it's just super important that all of your community's initiatives are at least coming together to have conversations and share the data. Are there any questions out there that people have for the Itasca County team?
I'm interested in how you became a team, and if you're from a nonprofit and you're a collaborative coordinator and from the school, is the school person and the nonprofit person, is what you're doing part of your actual job, or is it above and beyond?
I can at least just say that the initial gathering of the team, and we're really hoping to get a really cool name at some point right now, the ACE Hope cohort. So part of, well, I'll just say that the part of this group was, these were all our ACE trained presenters in Itasca County from when we initially went through ACE training. And part of that group really became kind of our core group. And like, as Angie indicated, we kind of divided the work into two buckets. We really, as we started doing the presentations in the county, we really pretty immediately knew we wanted to infuse some Itasca County data. So some of our presenters are working kind of in that subcommittee, and then some others of us are trying to figure out how we're, bridging and building this kind of message of hope throughout our whole community. Dr. Linkenbach's work also deals with hope and its health outcomes of positive experiences. And that article he was commissioned to write that article as a co-writer to the CDC's question on ACEs. It's kind of an answer to ACEs. So we can probably get that article up in the chat too. But so that's how we all came together. And then I'll let the other gals talk about how we're continuing in that work.
I think for me, like, our school leadership sees the direct link between building resilience and student outcomes. And so even though it's not necessarily like a part of my role in my job description, like, it is 100% a part of my role, is helping students, be their best selves and whatever that looks like. And so there hasn't been any concerns with me continuing to be a part of the process or the programming.
And I'd say really similar to Tana's, while it's not necessarily written into my job description, my job allows the flexibility for me to, meet during the day or do that work. And sometimes it maybe fits nicely into a work week, and sometimes it ends up being above and beyond. So I think it just kind of depends on the day and what else I have going on.
And I think like COVID has hit our group as well, and we haven't been able to gather. And so we're all anxiously looking forward to kind of reassessing where we're at. We do have in our goal of our resiliency planning, goal number 1, that eventually we would like to have like a paid staff to be working and getting this work out. We've had support from our Blandon Foundation in our community. So they have been really able to continue to gather this group together and keep the momentum going, which is great because like Angie said, we're all employed full-time in other positions. So it's great to have that agency see the importance of the work, and it aligns with their strategic plan as our community foundation that's, promoting leadership and equity programming.
And just a kind of couple follow-up connections on the over and above. Stevens County, which also was a microgrant recipient, used some of their funds to hire an intern to help develop their online community resource. So that was an opportunity. And then also on that whole, coming up with a cool name for your group, that's actually something I've seen communities write into their community resilience plans, is kind of do some of that branding. And Beltrami County recently came up with a really lovely logo of a chickadee. And it's because chickadees are the one bird, and Wendy can correct me if I get this wrong, that will actually take in other birds and help care for them and their little bird family, which is just kind of sums up the work that they're trying to do. So any other questions for the Itasca County folks? Or if not, I know we're getting close to lunchtime, and Emily wanted to make some announcements about the rest of the afternoon. So Emily, if you want to take it away.
Yes, thank you. I was trying to keep up with the chat. So, all right. Well, thank you so much to our wonderful presenters today. I'm just going to pull up my notes quick. Thank you to all of you for joining us, and especially a big extra thank you to Melissa and Angie, Tanis, and Kim for sharing about the process of using this tool and also what it looked like in the Itasca area. It has been really inspiring, and I just wanted to thank you all for joining. We want to make sure you do get in a stretch break and a lunch break before our next session. So our next session will be, in case you're interested, it'll be a grounding and mindful eating activity over lunch. So if you're interested in practicing the skill of mindful eating and grounding through that process, we invite you to join us from 12:15 to 12:45 today. I will put the link in the chat so you can just check that out at the at our event website right now. And then we'll also be having our final kind of wrap up of the full event from 1 to 2:30 today with our keynote speaker, Dr. Diaz, who is a nationally known speaker and scholar. He's the author of the Cherry Blossom Study that we often refer to in the ACE Interface presentation when we talk about epigenetics and historical trauma. And he's just a thought leader in the field of epigenetics. And we'll be talking about undoing cycles and breaking cycles of harm and trauma and kind of contextualize that within the community lens. So we're really excited to be welcoming him this afternoon. So we hope you'll stick with us and also take a little bit of a break today between sessions, and please let us know. We'll stick around if you have any other questions for us. We just really appreciate all the attention and time that you've put in, and again, a big thank you to the presenter team today for sharing all of their wisdom and experience. Thanks, everyone.
Yes, I just wanted to say thank you so much to the presenter team. You did a great job. I really enjoy hearing and learning. Thank you.
Thank you, Lisa.